6:02 on a Friday this morning, new masking guidelines from the CDC. If you're fully vaccinated, for the most part, you no longer need to wear a mask indoors. For over a year, though, covering our faces has really just become part of life. Health experts think getting rid of masks could entice more people to get vaccinated. This weekend, many states across the country are now lifting those mandates there. But we want to go in depth on these new guidelines right now with our ABC 15 health insider, Dr. Janice Johnston from Redirect Health. Dr. Johnston, of course, I want to thank you for being with us this morning. Now, yesterday, when the CDC put out this news, it was quite a reversal from what we've seen really this entire pandemic. So I want to ask you this. What are you going to tell your patients about wearing masks?
So I think everyone still needs to evaluate their own risks, right? So, I'm encouraging all of my patients to get vaccinated. That's number one. And if you've been on the fence about it for a little while, I'm definitely encouraging people to go ahead and get vaccinated. I think this latest recommendations from the CDC really shows us how effective vaccinations are in terms of keeping us safe. And so this is just a wonderful day to be able to get to this point where we can get back to some normalcy.
And Dr. Johnston, this is a question we get all the time. Can somebody who is vaccinated and somebody who is unvaccinated hang out together? What do you think? Without a mask, I should add.
So the current recommendations from the CDC are only with regard to people who are fully vaccinated. So just to remind the listeners, what that means is that you've had both doses of Moderna or Pfizer, or one dose of the J&J vaccine, and you've gone 2 weeks beyond that date.
Okay. What about people who have been working from home? And I know that this is something that's been debated, but do you think that because the CDC is saying fully vaccinated people don't need to wear a mask inside, do you think this is something that could maybe speed up the process of moving people back into the office quicker?
Absolutely. And I know a lot of employers, we've figured out how to work from home effectively, but a lot of employers are definitely wanting their whole team to be together. I think this is an opportunity for employers to get people back together.
Okay, I want to just ask you this real quick as a provider, and you and I have had several conversations on air, off air. As a provider, when you heard the news come down from the CDC yesterday saying that fully vaccinated people don't need to wear a mask, I mean, for a lot of us, it was quite a reversal. So what was your initial reaction to that?
I think in the medical community, we've actually been waiting for this announcement and have known how effective vaccines have been. So it's actually something that's very welcome. I'm surprised it happened so quickly, just because our community is not all the way where we would want it to be, but it's definitely something that's welcome. I do want to remind everyone that even though you're fully vaccinated and if you have an immune condition, your immune system might not be as strong. We're still not quite sure how effective the vaccine is for you. So I would recommend someone who's immunocompromised to continue to wear their mask.
Okay, and just to reiterate your point off the top of this interview, you said evaluate your own risk there and make it a decision for yourself. It really is a personal choice. Dr. Janice Johnston, I want to thank you, our ABC 15 health insider from Redirect Health. I really want to thank you for this. Always a pleasure getting to talk to you and getting your insight. We're going to catch up with you in just a little bit in our next half hour. So Dr. Johnston, thank you. We'll chat with you then. I appreciate it, my friend. And if you have any questions for our ABC 15 health insiders, email healthinsider@abc15.com. Like I said, we'll be speaking with Dr. Johnston again in our second half hour. Allison here. She's helping us go in depth and break down really what's been a monumental decision from the CDC.
Yeah, and answering so many people's questions as well. Maybe things that they've been afraid to ask and other people have sent in. So we're looking forward to that, Nick.